This is Richard with Wisdom Investor. And what we're going to take a look at here today is Medicare health insurance. We're going to explain the big picture here for Medicare health insurance. This is a one of six-part series on Medicare. We're going to also look at Medicare Advantage plans, Medigap plans, have some questions and answers. Also look at some alternatives and some alternatives for dental care. So appreciate you watching us here today. Typically, when we look at health plans, we look at the plans, we look at the features, and we look at the pricing. Or what we should be doing is looking at our needs, evaluate our needs and our wants, how we're going to use this, look at the plans, and then look at the pricing. Now, the nice thing about Medicare, when you turn 65, you're eligible to use it. The cost of the insurance is much less. So that's an exciting part of Medicare. Prior to 65, insurance is extremely expensive. So I appreciate you staying with us here today as we explain Medicare health insurance. Okay, let's take a look at what are the parts of Medicare. These are the major parts. There's a Plan A, hospital insurance. This everybody gets once they are 65. Generally speaking, no cost to this unless you haven't worked enough to earn enough Social Security credits to have this paid for. There's a Part B medical insurance. So these are A and B. These are typically the two that you get if you're just using the original Medicare plan, Part A and Part B. Part B is going to have all types of outpatient home health care, where Part A is really dealing with the cost of the hospital. And then the other part is Part D, prescription drug coverage, cost of prescription drugs. Then there's the Medicare Advantage plan on the right. The Medicare Advantage plan is a package of the Part A, Part B, Part D, and there's also extra benefits, and it can help lower out-of-pocket expenses. Over here on the left is original Medicare, Part A, Part B. You're going to pay about $144.30 per month for Part B, and Part D, the average cost on Part D is about $33 per month nationwide. Then that can vary depending on the area that you're in. And you can also get some supplemental coverage, which is part of the Medigap plan. Now on the right, we talked about the Medicare Advantage plans. Typically, the average cost nationwide is about $30. The range can be from $0 to $200 per month. It's all going to vary depending on what is covered and the deductible, etc. Now, the Medicare Advantage plan is, as we said, is a package of all of the parts of the Medicare plan. We're going to look at some of the features here of the original Medicare and the Medicare Advantage, kind of compare them. As we said earlier, it's really best to look at your needs, what you need. Are you needing drugs? Are you needing prescription drugs? Are you needing hospital care? And then try to find the plan that meets your needs. Maybe you want a specific doctor, or you could choose another plan where it doesn't really matter what doctor, you just use the in-network doctors. So here's original Medicare. Original Medicare includes Medicare Part A and B, hospital and medical. If you want drug coverage, you can join a separate Part D plan, as we talked about, to help pay your out-of-pocket costs in original Medicare, like your 20% co-insurance. You can also shop for it and buy supplemental coverage. We haven't talked about the supplemental, but that's an additional way to help lower some of your costs. Now, in the original Medicare, you can use a doctor or hospital that takes Medicare anywhere in the United States. So any doctor that takes Medicare, you can use them. Now, looking at Medicare Advantage, also known as Part C, Medicare Advantage is an all-in-one alternative to original Medicare. These bundled plans include Part A, B, and D. So it's a package of A, B, and D of the original Medicare. Plans may have lower out-of-pocket costs than original Medicare. In most cases, you'll need to use doctors who are in the plan's network. So they're kind of like a PPO or HMO type setup. You would use the plans that are in, or that you would use the doctors that are in the network. Most plans offer extra benefits that original Medicare doesn't offer, such as vision, hearing, dental, and more. So if you want to broaden some of your coverage, you would use a Medicare Advantage plan. The last area of coverage is the Medicare Supplement Medigap Plans. And basically what these do is they cover the gap that Plan A doesn't cover, maybe Plan B. So if you chose the Medicare Supplement A plan, it may be an extra $15 per month, but it would cover the gaps in the, as far as the deductible in like Plan A, Plan B, and Plan Part A hospice. Now the most popular plan here is Plan F, and you can see here it has a extremely high coverage of the gap between what Medicare pays and what you would have had to pay. This plan typically ran between $0 to $74. It will not be offered to new customers any longer. So the next best plan is for the full coverage is Plan G. About 60% of the people carry Plan F, but Plan G will now be the most comprehensive plan for new customers into Medicare. Typically, it runs $90 to $120 per month. It can change as time goes here. So this is a review of the Medicare Medigap plans. Now, when do you get signed up for Medicare? If you're new to Medicare and you're turning 65 years of age, you want to sign up 3 months prior to age 65. You have 3 months prior to age 65 to sign up. You also have 3 months after the month that you turn 65. But if you wait until those last 3 months, there may be a delay in your benefits getting started. So if you're new to Medicare, you can use the 3 months prior to the age of 65. If you're an existing customer to Medicare, around October 15th of each year to around December 7th, you want to be re-evaluating your coverage. And if you're going to be making changes, you want to do it during that time period. For those who are using Medicare Advantage, starting around January 1st to March 31st, you want to be making changes if you're trying to make a change on your Medicare Advantage plan. So just to review our discussion here, we talked about the original Medicare, which is Part A and Part B. Part B is going to run $144.30. And then Part D is for prescription drug, and that's average cost of $30 per month. Now that's going to vary in each area. And you can also choose some supplemental coverages to help lower your out-of-pocket cost. Then on the right, we talked about Medicare Advantage plans. It's a package. It's going to cover A, B, and D. Also have some extra benefits, and it can help lower your out-of-pocket cost. Average cost on that is around $30 per month, but it could vary anywhere between $0 to $200, depending on the plan and the area. Thank you for watching our Medicare health insurance video.